Before I begin, I just want to say that what we're trying to learn are generalities. We're going to learn the rules and not the exceptions. As you go through the video, there will absolutely be different times when you're going to say, hey, what about this disease? How about that disease? Sure. There are always exceptions, and that's what you learn during your residency and beyond. But where you guys are starting out, you want to learn the general rules, and then you can build on and learn the exceptions. You guys are back. Okie dokie. We are now on nerve root disorders. Wonderful. For starters, what is a nerve root disorder called? This should be pretty easy, guys. Pretty easy, straightforward. It is called a radiculopathy. Awesome. Radiculopathy. So first, before we kind of talk about what is a radiculopathy and the hallmark signs and symptoms of it, I want you all to visualize a nerve root. Okay, this is actually extremely, extremely important. Don't skip this part of the video. Just kind of follow me through here. So get a cross section of a spinal cord and look at the different things that come out of the spinal cord. So you have a posterior nerve root and an anterior nerve root. These two nerve roots do different things, totally different things. And in basic sciences, you guys are taught nerve roots as one entity. I don't like to think of it that way. I like to think of it as two separate nerves coming from two different parts of the spinal cord. They happen to travel together through the neuroforamen, but they're two different nerves. So you have the posterior nerve root, which is what? What does a posterior nerve root carry? Easy question, guy. You should know this. Easy question. Sensory. So posterior nerve root is sensory. So what does the anterior nerve root contain? If you know the posterior, you know the anterior. You got it. Come on, guys. Yep, it is motor. So the posterior nerve root is all sensory, coming from the periphery, from your sensory receptors, up the nerve and into the nerve root, into the posterior horn of the spinal cord. And the anterior nerve root, ventral nerve root, is motor. Don't forget, sensory goes from the periphery to the spinal cord. Motor nerve root comes from the spinal cord to the muscles. So don't mix that up. Please, please don't mix those two different nerve roots up, because they do different things. So a simple question, which may not have been obvious 5 minutes ago, but how many nerve roots do you have at each level? Not one, but 4. You have right dorsal and ventral, and you have left dorsal and ventral. So this is a concept that almost 100% of students don't appreciate until we go through this discussion. So please spend a moment, learn that anatomy, extremely important, and then let's continue onwards with a radiculopathy, hallmark signs and symptoms. Okay, so now if you have a nerve root problem, is it normally unilateral or bilateral? It seems pretty obvious if you look at the cross-section, right? It's usually unilateral. You're not going to have typically, now we're trying to learn the general rules. If you give me an example of a patient that has a bilateral, okay, that's fine. It happens. But I'm trying to have you guys learn the general rules. So if you look at the cross-section, it's very unlikely to have a nerve root pathology affecting both sides at the same level at the same time. So now that we know it's unilateral, okay, what are the signs and symptoms? Well, now this is where it gets tricky. Most folks mess this up. So think about this. If you have the sensory dorsal nerve root involved, then you have sensory symptoms. But if you have the ventral nerve root involved, then you have weakness. And if you have both nerve roots involved, then you have sensory and motor involvement. So more important definitions here. If you have sensory symptoms caused by a nerve root problem, what part of the body will be affected? Think about this. So if you have a nerve root involved, sensory, then you're going to have sensory symptoms along a dermatome. And if you have motor symptoms, weakness, atrophy, fasciculations, all those kind of lower motor neuron motor symptoms caused by a nerve root problem, what kind of problems would you have? And along what distribution? It is not along a dermatome, because dermatome refers to the sensory location. So you would have weakness and motor symptoms along a myotome. So in summary, a radiculopathy will cause unilateral sensory symptoms along a dermatome and or motor weakness along a myotome. Memorize that, learn it up and down, left, right, don't forget it. And now we are halfway done. We are now done with the peripheral nervous system. So the next video is spinal cord. So again, think about the hallmark signs and symptoms, think about the anatomy, and then what is a spinal cord lesion officially called? So think about all those concepts, and we'll see you shortly on the next video.